The Francis Nelson Health Center was started as a successor to the North End Clinic. Now, I need to go back and give you the history of the North End Clinic. It was in 1968. A group of young black men in Champaign created an organization they called SOUL, S-O-U-L, for Security, Opportunity, Unity, and Love was the acronym. But we also were made privy to the information from a graduate student thesis at the University of Illinois that the infant mortality rates for black children was significantly higher than for white children in Champaign County. And it doesn't make any sense that if you're getting timely health care that you would have a differential between the survival rates by race of one group as opposed to another. We decided that we had to address it in a more comprehensive fashion and started to look at options that might be available to us, like a free health center. And Carol Barkstall, Carol deserves a lot of credit for helping to organize us in a way that would possibly end up with a free health center for people of color, and also, as we soon found out after the North End Center was open, had a population that it was serving that went far beyond the black community. Working class white community had the same issues. Graduate students at the University of Illinois had the same issues, and they were willing to forego the racial prejudices that had existed in prior years that divided the community by race. Very significant. It's kind of difficult to convey today the hard issues that existed in the 1960s and before, that race was to be honored by the system in all aspects of life, in where you could live, how you could live, and what you could do and what you could not do.
I just like to add to what William said that context is important. We were all pretty much segregated in what my parents called the East Side and what later was called the North End. The young people of that period, what differentiates them from young people today is that they were we were proactive, saw a problem, tried to come up with a solution, or did come up with a solution to that problem. Today, most of the things that you see are young people who are young leaders are reacting to a situation. They wait until something happens and then they react to it. But this was a little bit different in that time period. Nothing would have happened if these young African-American men had not taken the ball and ran with it.
But by then we were getting volunteers from all over the community. We attracted people of goodwill, from doctors to nurses to lab techs, to all people who saw the problem as a problem that they want to be a part of solving.
There was at one point a need to expand those services. And that's one of the motivating factors of why Bill and others and Vern Barkstall looked to get a larger facility. Because as the graduate students came in and others, there was a need to understand what capacity North End Clinic had to serve these groups, thus a need to move to a larger facility.
We looked to available space on the North End. Francis Nelson Home was vacated, and it was vacated because racial segregation of children became against the law, and so it was no longer needed. And the Optimist Club was willing to provide us that space if we would maintain the name Francis Nelson. So we maintained the name Francis Nelson and became the Francis Nelson Health Center. And that's the background to how things got started in that particular location. Soon we came up against a real problem, the almighty dollar. Providing free services, there was no cash flow. And there was no way to replace the materials and that were being utilized for healthcare. We had donations that the doctors brought with them, and other professionals brought donations from their areas. But after a while, we had such a clientele that was not enough. And so we had some very innovative, imaginative things that were done by the Illinois Department of Mental Health. They were hiring and funding neighborhood services to reach out to the communities. This was an opportunity for them to use their expertise to try and overcome those biases that they were not in agreement with, even though they worked within the system that exercised those biases. And I am forever thankful for them being willing to stand up and stand out, in spite of the fact that it jeopardized some of their jobs if it were known that they were providing free health care in Champaign County. But they did it because it was the right thing to do. It was an eye-opener to see these people willing to step forward to be a part of the solution and to try and address the problems that they knew existed in the system. We were extremely fortunate to give an outlet for all of these wonderful people. These wonderful people said, we're going to do it anyway. The energy to do these kind of things has to come from within, because people are being asked to go outside of their areas of comfort or into new areas that they are in those areas because they know that things are not right, but somebody's got to be there to make it right. If you don't make it right, it's just going to continue to be wrong.